Welcome to Hospital Rounds. I'm Kirsten Nulon, the Director of Communications and Development, and we are here to do another Hospital Rounds video with our radiology department. So just like every nurse and doctor has to round on their patients in the hospital to ensure timely care and keep their patients up to date on their care plan, so we are rounding on the different units, departments, and clinics in our community that are part of the Hillsdale Hospital system to ensure that you, our community, are up to date and in the know about what's going on at Hillsdale Hospital and what you might need to know about the care that is available to you. We are here in radiology today to talk to some wonderful team members who are working very hard to provide excellent patient care here on our main campus of Hillsdale Hospital. I'm here with Jamie Caldwell. Thank you so much for being here, Jamie.
Thank you for having me.
Absolutely. Can you introduce yourself for our community?
Sure. My name is Jamie Caldwell. I'm the Director of Ancillary Services here at Hillsdale Hospital, and I've been here for 25 years.
Amazing. Wow. So tell us a little bit about the radiology department. What is the mission of it, and what are some of the different kind of basic services that are involved?
Sure. So we have all the basic services of a radiology department, including X-ray, CT, MRI, mammography, ultrasound, nuclear medicine, echocardiography, and DEXA.
That's amazing.
And our goal here at Hillsdale Hospital is to make sure we provide quality imaging for our patients. Yeah. And not only quality, but make sure that we provide all the services that you can get at a much larger hospital as well.
Yes, and with the same top of the line equipment,
top of the line technology.
Yeah, we kind of get some questions about that sometimes with if our equipment is kind of up to date and on par with some of the more advanced equipment, and it absolutely is the exact same equipment, right?
If not better.
If not better.
Yeah. Yeah. We've actually had some equipment installed that we were some of the first in the state and a rural hospital to have. So
yeah, absolutely. I know we've had some procedures as well that we've done that are also the first in the state. So really cutting edge, innovative care that we can do here.
Absolutely.
So tell us a little bit about some of the kind of goals that you have for patients and how radiology plays a role in the different departments, the different services of the hospital, and how it's kind of integrated into a patient's care journey.
Sure. So we're kind of the eyes of the medical field, right? So if a physician decides that you're having some symptoms or concerns that need to be evaluated, we're typically one of the first places that you'll come is for imaging. So we give them an overview of whatever they're looking for as a diagnosis and can help them start the patient in their journey of detecting what may be wrong and then also the healing journey from there.
Awesome. That's great to hear. And I know that we do PET CT, but that's a little bit different than what we do right here in this department, right?
Sure.
Yeah. So what is kind of the difference in the process for getting a PET scan versus doing anything else in this radiology department?
Sure. So for PET, that's done on a mobile trailer. So it comes to Hillsdale Hospital twice a month. And if your provider feels that you need to have a PET scan, then there's a separate scheduling number that's done for that. It's actually done through the mobile PET company and not through the radiology scheduling department.
And that's a wonderful partnership that we have with the HCS group that we're able to provide and certainly fits into our department's, your department's overall mission to provide great care. So one of the kind of steps that we took to ensure great care for our patients recently was last year when we made a little bit of a change to a different radiology group. Can you tell us a little bit about that group and how things have really transformed in this department since that happened?
Sure. So if you think about it, I mean, for a small rural hospital, we do a lot of imaging. We are the only imaging hospital in the county. And so with that volume, it takes more than just a couple radiologists to provide services for those patients to get the results to them and their providers in a timely manner.
Yeah.
So we transitioned to Premier Radiology, which is a large group of radiologists. And so they've been providing excellent care for our patients and our providers, and our turnaround times for reports have been excellent, almost everything within 24 hours.
We are here in the CT room in the hospital to talk with Ashley a little bit about CT. Welcome, Ashley. Thanks for joining us.
Thanks for having me.
Absolutely. So can you introduce yourself a little bit to our community? Tell us how long you've been here and what your role is at Hillsdale Hospital.
So I'm Ashley. I am the radiology charge technologist, and I've been here for 9 years.
Amazing. Thank you, Ashley. I know you're very loved by patients and our staff as well. So tell us about CT. What is that and what role does it play in patient care?
So CT is computed tomography. It takes hundreds of images in slices, and then it puts them together and then creates an overall image for the radiologist to look at.
Okay. And what is that images of? Is it just the head?
Anything. It can be the head, it can be the body, any bones.
Yeah.
Anything.
And this is, I'm assuming this is a CT right here.
Yes.
Okay.
Yes, this is the scanner right here.
I've heard it called, correct me if I'm wrong, Is this called the donut of truth?
It can be.
I've heard that.
Yeah, sure can. There's no lies.
Okay. So tell us about some of the conditions or symptoms that might lead a patient to need a CT.
So there could be injury, like if there's a motor vehicle accident.
Okay.
If they're looking for a fracture, there's cancer, infections,
Okay.
brain bleeds, anything like that.
Big variety.
Yes.
And how long does a CT typically take? What's the process
Patients
like?
usually on the table, like less than 3 minutes.
Wow.
Just depends on if it's
Really
with
quick.
contrast, without contrast.
Okay. And let's talk about that. What is contrast?
So
and how does that
contrast
work?
is injected through the bloodstream, and it highlights the organs or the
Oh,
vessels
okay.
of the body.
So it makes the images look different.
Yes.
And then once the patient kind of goes through the CT scanner, those images are sent to the radiologist to
Correct.
read?
Yep.
Okay.
Sometimes we have to process them and
Sure.
create different views for the
Okay.
radiologist, but then we send them off to the
Right. And because our radiology read times are so wonderful now, and we've had such a
Right.
rapid improvement
Absolutely.
of that, then those are sent, I'm assuming those are sent back to the physician that ordered.
They can see them,
Okay.
yes. Yep.
And then who would typically send a patient to get a CT? Who would order it for them?
Anybody, primary care,
Okay.
ER physicians or hospitalists often order on the
Okay.
inpatient side.
So a patient could be in the hospital
Mhm.
for something, they could be in the ER, or they could just be in their primary care
Right.
setting, talking about something, and the physician or the provider just says you need a CT scan.
Correct.
Okay. Now we are in our nuclear medicine room. I'm excited to be here with Jordan. Welcome, Jordan.
Hi, thank you.
Yeah, can you introduce yourself to the
Yeah.
community and tell us what your role is here and how long you've been at Hillsdale Hospital?
So I'm Jordan Wentworth. I'm a certified nuclear medicine technologist. I've been doing nuclear medicine for about 20 years now.
Wow.
Here, about 3
Okay.
years or so, real close to that.
Yeah.
So we do all forms of general nuclear medicine here, including stress tests, HIDA scans, lung scans, liver scans,
Okay.
bone scans, things like that, the real
That's great.
common things that a lot of people need to have.
Mm-hmm.
A lot of nuclear medicine is focused more on functional imaging
Mm-hmm.
rather than just anatomic.
Yeah.
That's why a lot of our tests are kind of long-winded. Like one of our studies, the gastric emptying study, that's like a 4-hour test.
Oh, wow.
But it does show information that other tests don't.
Yeah.
Instead of just taking a picture of the stomach or other organs like that, it actually shows how it's working. And that's why the tests often take so long, is because of that functionality
intricate.
aspect. Yeah.
Okay. So you mentioned a few different tests. Can you walk me through a few of those and tell me what they are? Because I don't know if that's completely common knowledge. And
Okay.
as your listing knows, I didn't know that all of those even fell into the category of nuclear medicine.
Yeah.
So tell me about a few of them and what role they serve in patient care.
So I'll tell you the most common ones.
Yeah, that'd be great.
So a HIDA scan gallbladder
Okay.
study, that's evaluating
Okay.
to see if the gallbladder is both filling and emptying correctly.
Okay.
Okay. So for that test, the patient's going to come in. We talk about things, get history. I do have to give a shot for that.
Okay.
And a common misconception with nuclear medicine is that we're giving people contrast or dyes,
Mhm.
and we're not. It's a radio tracer.
Oh,
And that's an
okay.
important distinction, because a radio tracer actually has no side effects and
Yeah.
elicits no response from the body.
Yeah.
Where dyes and contrast can
yeah.
have side effects.
Okay.
So that makes people feel better once we kind of get that out of the
Yeah.
way, you know. But anyway, like if I want to do a HIDA scan on a person, I need to inject them with something that will be attracted to bile, because that's what a gallbladder does. It stores
Oh.
bile.
Okay.
So I would give them a shot of something called mammography,
Mhm.
and that is a chemical that is attracted to bile. And I would give them that shot. We'd put them on a table and start doing the scan. And what would typically show up is that the liver would start to show up, because that's where bile is made.
Okay.
And then the gallbladder should show up, you know,
Yeah.
at some point within that hour, it typically does.
Yeah.
And then if everything's showing up at the end of an hour, then I would give them something to drink, which is just a little shake.
Okay.
And all that food does is start the digestive process to kick in, and that would
Wow.
stimulate the gallbladder to contract, throw bile into the system, which is what it should do.
Yeah.
And by analyzing all that information on the computer after the patient's gone, we can tell if that gallbladder is working the way that it should.
Wow.
So, yeah,
that's very complex.
Yeah,
That's amazing.
that's a HIDA scan.
Okay.
And so what happens is the shot that I give the people, that camera detects it.
Okay.
So that's a big distinction between this and pretty much everything else in radiology.
Yeah.
Because in say a CT scanner or an X-ray machine, something like that, we are creating radiation, shooting it through the patient to a detector. Where with this, the patient is emitting the radiation. It's nearly identical to an X-ray, but it's emission rather than creating and passing through. Yeah.
Wow. Does that have, you mentioned that doesn't have any kind of reaction from the body. Does it have a similar effect as just radiation?
Yes, there is a radioactive aspect to it, but it doesn't create any response from the body to where you like feel sick or something like that.
Okay. That's
so
great.
Just like you'd have a CAT scan and not know you had one other, you know, then you went through it. You don't tell anything from it.
Okay, that's great. We are now in our mammography room with Bonnie. Welcome to the video, Bonnie. Thanks for being here.
Thank you for having me.
Yeah, can you introduce yourself to our community, how long you've been here, and what your role is?
Hi, I'm Bonnie Schaefer. I have been here for over 33 years now and doing mammograms that entire time along with x-rays.
Wow.
I am a mammography tech.
Okay. I cannot even tell you how many compliments I've heard about your patient care and the work that you do with patients. You're just so caring and kind, and you have a wonderful bedside manner. So patients are very appreciative of that.
I try.
You do a wonderful job. Tell us a little bit about mammography. This is something that I think is kind of feared a little bit for some women. Tell us what it is, what it's for, why it's important.
It is scary the very first time you have it because you don't know what's going to happen.
Yeah.
It's an x-ray of your breast to check for breast cancer.
Sure.
The very first time you come, you're more likely to get called back than other times because we don't have anything to compare it to.
Yeah.
With mammogram, you want to look at from year to year to year and see if there's any changes in your breast.
Okay.
So I always tell the first time people, you may get called back because if you don't, and they get called back, then they're just scared to death that they have breast cancer.
Yeah, that might not be why.
No, quite often it's not because we just have dense areas and we can't see through it.
Yeah,
That's called a diagnostic mammogram. We do extra views. To you, it probably feels about the same as what we did before, but we use a smaller paddle, just goes over just that area. We don't put quite as much compression on it because if you use a larger compression, it puts less pressure on than a small one does.
And this equipment is beautiful.
Top of the line.
Yeah.
Yes, beautiful.
It's wonderful, very advanced technology that we have here through our entire radiology suites. Talk to me a little bit about when someone should start having a mammogram and how often after the first one.
Usually you start between the age of 35 and 40, depending on your family history and your doctor.
Okay. Yeah, so you should really work with your primary care, I'm assuming.
Absolutely, because they know your family history. They know you.
Yeah.
You know,
and then
like,
when you,
like for me, I have zero family history of any breast cancer problems. So my doctor started me at age 40, but you might have a grandmother that at 34 had breast cancer. They're going to want to start you at 35 rather than waiting till 40.
Yeah, that makes sense. And then once you hit 40, how often do you need to do it?
Usually every year until you're about 55. And then between 50 and 55, that changes to, some doctors will do it every other year. Some of them keep it at every year.
Okay.
And then the ACR is at 75. You can choose if you want to continue to do it.
Okay.
Most doctors like to have you, if you have problems or issues or family history, to continue to do it.
Okay, but just depending on that relationship with the primary care provider, and you can
it's very important to do that.
Absolutely. We are now in the ultrasound room here with Lindsay. Thank you so much for being here, Lindsay. Can you please introduce yourself to our viewers and tell us what you do and how long you've been here?
My name is Lindsay. I am the diagnostic medical sonographer here at Hillsdale Hospital. I've been with our organization for 11 years.
Wow.
7 of them in diagnostic imaging.
Wonderful. Thank you so much for what you're doing. I know this makes a really big difference for patient care. Tell us a little bit about sonography. What is the main goal of it? Is it just for, I know a lot of people associate this with being pregnant and getting an ultrasound of your baby, but what else is it used for?
So that is a big part of what we do, is baby imaging.
Absolutely.
So we do abdomen ultrasounds, scanning for any abdomen pain, sometimes abnormal blood work. I'll land our patients here for the start of their imaging.
Okay. Yeah.
Of course, through our department,
Okay.
we check for gallstones, liver disease,
Yeah.
kidney stones.
Wow. That's
all
all
that kind of stuff.
really important. So, are a lot of your patients from the ER? Or just refer from primary care?
So a lot are outpatients from primary care.
Okay.
We have 2 different rooms that we run schedules. We also have an evening schedule that typically I actually am the one working that evening schedule. And then in between our scheduled patients, we do ER, emergent ultrasounds of all kinds.
Okay.
And then as in with our floor,
Okay.
inpatient floor, we do.
Yeah, that's great. So I'm assuming ultrasound is very portable. You can just take it
It
with
is.
you. That's
Yes,
great.
a very small unit.
Yeah.
These are brand new. They just got updated in the fall last year.
Yeah.
So we're loving them. Their
Yeah.
quality is great.
Okay.
So we unplug them.
Mhm. So Lindsay, tell us a little bit about your approach to patient care. I know that sometimes with ultrasounds or any kind of test, really, there can be some nervousness or apprehension waiting for results. So how does your team approach that?
So we always try to create a comfortable environment.
Yeah.
Usually it's a lot dimmer in here than it is
Yeah.
right now. And just try to understand their situation, and explain to them that we're going to do everything we can, get all the imaging. The doctor will have them within a couple business days.
Yeah.
And that they will reach out to them with the results.
That's great. Now we are in the X-ray room to talk to Grant, one of our radiology team members. Welcome, Grant. Thanks for being here.
Thank you.
Yeah. Can you introduce yourself to the community and your role and how long you've been here?
I'm Grant. I've been a registered tech for 22 years and been here
Wonderful.
my whole life. Started out here on my career.
Amazing.
Schooling,
Well,
so
I know that you're just a beloved team member of this group.
thank you.
Can you tell us a little bit about, you've been here for over 2 decades. How is the radiology department different than it was 22 years ago? How have you seen it evolve?
When I started, we had actual film that we had to process.
Wow.
Worked in the dark room. You get stuck in the dark room for a while.
No.
It was
Yeah.
crazy. But the second year we went into digital, and every few years we've gone up from there till
Wow.
we're into what we are now, the direct
Yeah.
digital imaging.
Tell us a little bit about what X-ray does. What is the purpose of it, and what role does that have in patient care?
Well, if somebody comes in, they have a ATV accident, something like that, we
Okay.
bring them over.
Yeah.
Usually mostly CAT scan gets that used for that. But, there's certain things we go over for traumas. We'll do a chest x-ray, a pelvis x-ray right off the bat just to make sure everything's okay before we move
Yeah.
them.
Okay.
So,
So you don't want to miss anything.
Right.
Is that something I've heard is it can be kind of difficult, or it can be easy to miss something when there's been an accident. You're
Sure.
focused on so many things, and I know you guys play such a big role in that. Tell us how you use radiology in all these different departments: ER, surgery, outpatient. What does that look like?
we can go over and do portable x-rays over there.
Okay.
Not for everything, but,
Yeah.
in a trauma situation, we do quite a bit of
Absolutely.
portable stuff. So
Yeah.
we can do that over there. We can do that upstairs in the patient's rooms also.
Okay. Wow.
So
you don't even have to move a patient who's here to get an X-ray.
No,
Wow.
not in a room. I mean, once we get up there, we got to get
Sure.
our stuff underneath
Sure.
them and that. But
Okay.
yeah, as far as like bringing them down, you don't have to bring them down for everything. So,
That's great. And then what is your role in the OR during the surgeries?
we assist the doctor in like orthopedic stuff where they're replacing hips and things like that. We take pictures so they know where they're at.
Okay.
And
Yeah.
testing the size to make sure they put the right size in and things like that.
Okay. So ortho, I'm assuming anything with spine
Yep.
would be okay.
Yep, we do quite a bit of spine stuff, 3D.
Is there typically any preparation needed for an X-ray?
Depends on what you're doing.
Okay.
If you're doing something like fluoroscopy,
Yeah.
we might be doing a
For our viewers, can you tell us what is fluoroscopy?
Sorry.
Define that for us.
It
Yeah.
is live x-ray. So we actually have the patient drink something, we can watch it go down through them.
That's so
It-
cool.
It is cool. It is.
Kind of blows my mind.
Some of them we have to have them cleaned out, so we have to do kind of like if you're getting a
Like a
colonoscopy,
Okay.
yeah, you just have to clean out a little bit
Yeah.
because
Sure.
of what we're doing. Depends
Yeah.
on what we're doing.
Now we're going to talk about scheduling and how to get an appointment for radiology and to get in for your test. So this is Natasha. Welcome, Natasha. Thanks for being here.
Hi, thanks for having me.
Absolutely. Can you introduce yourself, what you do, and how long you've been here?
Yeah, hi, my name's Natasha. I've worked here for a little over 5 years and I work in radiology scheduling.
Amazing.
Yeah.
So let's talk a little bit about maybe a provider orders a test or a scan for a patient. How does that process work? Do you call them? Do they call you?
Yeah, typically the ideal situation would be to have the doctor's office give us a call and go ahead and get that scheduled.
Okay.
That way, if there's any like extra details we need, like authorization or certain prep, that we could go ahead and communicate that with that doctor's office to
Great.
get that. Yeah, so that's the ideal way.
Okay.
With a doctor's order, we can schedule, the patient can self-schedule if they
Okay.
do have the doctor's order, but we do have to have a doctor's order to schedule.
Absolutely.
Yeah.
Absolutely. Okay. So how long does it normally take for a patient to get on the schedule once either they or that office is calling to make that appointment?
Yeah, absolutely. It depends on the modality. Different modalities might be booking out at different times, but
Okay.
for the most, it should be less than a week, because usually if there's a modality that's booking out a little further, we try to make accommodations like opening up maybe at
Yeah.
different times that we normally wouldn't, just to allow for that overflow so we're
Okay.
not so far out.
Thank you
Yeah.
for joining us for Hospital Rounds with Radiology. We've been learning so much about our radiology team down here at the main hospital campus with CT and mammography and ultrasounds and so many different elements that work together to provide excellent imaging care for our community. If you want to learn more about the radiology team and different services that are available to you here, you can visit hillsdalehospital.com/radiology or talk to your primary care provider if you think that you need one of the services that we discussed today. As always, we're excited to engage with you again very soon. Visit our website to learn more, give us a call. We're excited to meet you to continue helping you with your healthcare journey. Thank you for trusting us with your care. And as always, remember, rural health strong.